Robert F. Kennedy Jr.'s planned trip to Texas, prompted by the possible second death linked to measles in the state, is raising significant concerns, especially given his controversial stance on vaccines. While the death is still under investigation, it serves as a sobering reminder of the risks posed by vaccine-preventable diseases. The child involved, part of the Mennonite community, follows the tragic death of another unvaccinated child from the same group earlier this year. This is deeply troubling, especially as Texas grapples with the highest number of measles cases in the nation, with 481 reported since late January. Kennedy's visit to Lubbock has been met with skepticism and criticism. His track record of downplaying the severity of measles and questioning the efficacy of vaccines has only amplified the fears surrounding his leadership at the Department of Health and Human Services. While he is technically in a position of authority, his reluctance to align with mainstream medical advice puts him at odds with public health experts, further exacerbating concerns about his ability to effectively address the ongoing public health crisis. The timing of his trip also raises red flags. The administration has been urging Kennedy to adopt a more visible, public-facing role, and this sudden trip could be seen as an attempt to placate critics and demonstrate some level of action. However, the reality is that his presence in Texas may not be the solution the state or the country needs. Given his previous comments on vaccine safety, it's likely that he will not be advocating for stronger vaccination measures, which is exactly what Texas, along with the rest of the nation, needs in light of the rising cases of measles. The death of a child is always a tragic event, but it should not be used as a political or publicity tool. While Kennedy's trip may serve to highlight the importance of addressing vaccine hesitancy, it is also a stark reminder that public health leadership requires more than just appearances. It demands evidence-based action, clear communication, and a firm commitment to supporting the recommendations of the scientific and medical communities. Unfortunately, Kennedy's history and statements suggest that he is ill-equipped to lead effectively in this area, making his trip to Texas more symbolic than meaningful. Furthermore, the growing number of measles cases in Texas should be a wake-up call for the entire nation. This is not just a regional issue. It has the potential to spiral into a national public health emergency if the spread of misinformation and vaccine hesitancy continues unchecked. Texas' alarming measles statistics underscore the urgency of ensuring that all communities, including those with religious exemptions, understand the very real dangers posed by not vaccinating. In this context, Kennedy's visit may do more harm than good if it fails to recognize the importance of vaccines in preventing further deaths and outbreaks. Ultimately, Kennedy's leadership, or lack thereof, in this situation highlights a troubling trend of misinformation and reluctance to engage with established medical guidance. The second death linked to measles in Texas and the surge in cases should serve as a clarion call for stronger action and a united front in the fight against vaccine-preventable diseases. If Kennedy's visit does not reflect a shift towards clearer, evidence-based public health messaging, it may only deepen the divide and delay much-needed solutions.